So the next topic is compartment syndrome. So compartment syndrome has been repeated 6 to 8 times in last 5 years of NEET PG and INACT exam. So what is compartment syndrome? So basically it is due to increase in swelling because of fracture, because of tight cast. टाइट कास्ट क्या करेगा, चारों तरफ आपने टाइट कास्ट लगा दिया तो दिस विल इंक्रीज द प्रेशर, दिस विल इंक्रीज द कंपार्टमेंटल प्रेशर and it can leads to compartment syndrome. Okay, and the second can be it is due to the fracture leads to increase in swelling which leads to increase in compartmental pressure and it causes the compartment syndrome. Okay, now what happened, because of increase in pressure in the compartment it presses the blood vessels, so it compresses the blood vessels, so it leads to ischemia, flexor group of muscle affected by ischemia. So FDP is the first muscle which is affected, flexor digitorum profundus, because it is bulky muscle. Okay, so because it is compression of blood vessel is causing ischemia which leads to inflammation, then compression, then necrosis, then fibrosis, and ultimately it leads to contractures. Okay, so what is compartment syndrome? It is nothing, जस्ट अज्यूम कि आप कोई चीज दबा रहे हो, है ना, तो हाथ की मसल्स होती है, फोरआर्म की जो मसल्स होती हैं, यू आर कंप्रेसिंग दोस मसल्स. ओके, एंड इट कुड बी ड्यू टू इंक्रीज इन इंट्रा कंपार्टमेंटल प्रेशर बिकॉज ऑफ फ्रैक्चर और ड्यू टू एक्सटर्नल जैसे आप कास्ट लगा देते हो, अगर आपने टाइट कास्ट लगा दिया तो इट विल कंप्रेस द फोरआर्म एंड ड्यू टू कंप्रेशन ऑफ फोरआर्म it leads to compression of blood vessels and compression of blood vessels leads to ischemia. Ischemia leads to inflammation, then it leads to compression, then necrosis, then fibrosis, and ultimately it leads to contracture. Okay, so it is a complication of, it is also a complication of supracondylar humerus fracture. Okay, now what is the most common cause of compartment syndrome in adults? In adults it is tibial diphyseal fracture. Okay, and most common in children it is supracondylar humerus fracture. So you have to understand the difference between both. In adults it is tibial diphyseal fracture, but in children it is supracondylar humerus fracture. So what is the cut off mark? कितना प्रेशर बोलते हैं कि इससे ज्यादा नहीं होना चाहिए इंटर कंपार्टमेंटल, दैट इज ग्रेटर देन 30 mmHg. Now it has 6 P's. What is 6 P's? Patient will present with pain on passive stage, pallar, paralysis, paresthesia, pulselessness, paralysis. So these are 6 P's of compartment syndrome. And how will you treat? By doing the fasciotomy. So what is fasciotomy? So because the compartmental pressure is increased already, so we will give the incision, we will give S shape. This is forearm, let's assume this is forearm, so we will give S shape incision, this is fasciotomy. So if you give the incision, it will release, it will open up the fascia and it will release the pressure. This is fasciotomy. Okay, so if you want these type of notes, so I have taught the entire orthopedics in my app. You can watch the free video of upper limb trauma in my app. Download the Dr. Priyesh Nayak app from Play Store or App Store and you can watch the free video. And if you like the free video, then only purchase the course. Okay, thank you.